Good morning, everyone. Welcome to Healthy Planning 101. My name is Christine Fry, and I'm the Program Coordinator for EdPlan. As you can see, we have an exciting lineup of panelists today, all of whom are working to improve the health of communities, like many of you. We at EdPlan believe that the public health tent should be as inclusive as possible to improve health, and in particular, to reverse childhood obesity. This web is born out of this belief that public health should engage everyone from lawyers, planners, developers, and the community. So we'll be teaching you the basics of healthy planning and demonstrate how these tools can be used in particular in childhood obesity prevention. This is our agenda for today. Even though this is going to be a large webinar with many participants, we've tried to include several opportunities for question and answer. I'm going to quickly run through some housekeeping items, and then we'll dive in with our panelists. So speaking of question and answer, if you have a question for any of the panelists, put that down in the Q&A panel, which is in the lower right-hand corner of your screen. That should only be visible to the panelists, and I will be monitoring those questions throughout the webinar and feeding them to the appropriate people. If you do not get your question answered and you would like it answered, I encourage you to go to the EdPlan website, which is edplanonline.org, and we'll show that link to you later in the webinar again. And click on the Ask a Question button, and you'll be able to submit your question to the EdPlan team. I have a staff person named Scott Watkins who's available to provide technical support for the first 20 minutes of the webinar in case you have any trouble signing on, hearing the audio, and so on. He's available by private chat and by phone at 510-302-3380. And finally, we will be sending an evaluation survey after the webinar, probably on Monday, and we really encourage you to complete that because it helps us to improve these programs for future audiences. So with that, I will pass the mic off to Manel Capagoda, the Deputy Director of EdPlan, to say a few more words about the project.
Good morning, everybody. This is Manel Capagoda, and as Christine said, I'm the Deputy Director of EdPlan. EdPlan is the National Policy and Legal Analysis Network to prevent childhood obesity, and we are thrilled that there has been such an enthusiastic response to this webinar. We think this is an incredibly important topic, and we're glad that all of you think so as well. I'm going to take a few minutes to give you a little bit of background about EdPlan. We're a program of public health law and policy based in Oakland, California, and we have been funded by the Robert Wood Johnson Foundation to provide legal technical assistance to communities around the country that are putting childhood obesity prevention policies in place. So what that means is we develop model policies and other tools for advocates and public health experts that increase physical activity opportunities in communities and promote access to healthy food. And we have a special emphasis on children and children's health. We work with local health departments, other local government agencies, community-based organizations, city attorneys, and county council, among others. I'm going to take this opportunity to just give you a quick example about what we mean when we say legal technical assistance, because it's not intuitive. It's often not clear to here at EdPlan. We are working with a group in Chicago called the Consortium to Lower Obesity in Chicago's Children, or CLOC. And CLOC came to us about 6 months ago and said, we've been doing a lot of work with our local park district around healthy vending. We have healthy vending into all park district facilities. Can you help us work with them? And so what we did is we provided a model annotated healthy vending contract. It's a complete contract between a government agency or a school and a vending company, and it is annotated so that advocates and others understand key contract terms. A special feature of this contract is that it promotes healthy vending, but also focuses on maintaining revenues, which was of interest to both CLOC and the Park District. We not only provided them with this information, but we also participated in a number of group conference calls between the Park District and CLOC representatives, and then provided CLOC staff with additional information about healthy vending. So that just gives you a sense of what we mean by legal technical assistance. I'm going to stop there, but we'll provide a little bit more about N-Plan services and our materials at the end of the webinar. Thanks again for joining us today.
Now, next, we have an introduction from Dr. Joe Thompson, the director of the Robert Wood Johnson Foundation's Center to Prevent Childhood Obesity.
With N-Plan to present this important webinar that will provide information we hope everyone on the line can use to develop land use opportunities that will improve health. The Robert Wood Johnson Foundation Center was created by the Robert Wood Johnson Foundation, which is the nation's largest philanthropy devoted exclusively to improve the health and health care of all Americans. As most of you know, the foundation committed $500 million or $500 million towards its goal of reversing childhood obesity in the United States by 2015, a bold move. This is the largest investment by any foundation focused on this urgent issue. As part of the commitment, $20 million is allocated to be used to fund the Center to Prevent Childhood Obesity. Our center, launched earlier this year, is becoming a leading voice in the national movement to reverse the epidemic through policy analysis, leadership, development, and communication with a broad network of advocates. We're working to enable children of all races, ethnicities, and geographic locations to eat healthy, be physically active, and avoid obesity. We're a national organization with staff in California, New York, District of Columbia, and Arkansas dedicated to working with all of you in reversing the epidemic by changing public policies and creating healthier environments in schools and communities. And the Center helps shape and coordinate the efforts of policymakers, advocates, and community organizations by identifying and promoting the most promising obesity prevention strategies and supporting the nationwide movement to improve food and physical activity environments. The goals of our center include reducing the prevalence of overweight and obesity among children in the United States. Also, equally importantly, decreasing the disparities in childhood obesity, particularly in communities of color, in impoverished areas, and in disproportionately affected regions of our city, states, and nation, and create systematic, sustainable changes that will last beyond the focused effort underway to reverse the epidemic. To achieve these goals, the Center focuses on synthesizing the science and best available evidence on childhood obesity to ensure that prevention policies and activities are built on what works, by educating policymakers and advocates about which national, state, regional, and local policies are most effective in preventing childhood obesity, especially in the communities hardest hit by the epidemic, by developing capacity and leadership in the movement to prevent childhood obesity, and by advancing effective communication strategies to build political will for the changes needed to reverse the obesity epidemic. As part of RWJ Foundation's commitment to reversing the epidemic, the Foundation has also funded 17 national program offices, all national organizations in their own right. The Center serves as the coordinator of the work that all these organizations are doing to prevent childhood obesity, and also strives to bring together the work of other organizations and individuals which are not part of the RWJF-funded community. Through that work, we can harness and expand on the best research and thinking happening across the areas of evidence, advocacy, and action. When it comes to provide technical assistance, the Center's offering is a broad-reaching, comprehensive, and designed to serve a range of diverse needs in multiple formats and venues. Our audience is the national program community, and this important partnership with the National Policy and Legal Analysis Network is a clear example of that, but we hope to offer assistance to all organizations working on childhood obesity. Our targeted technical assistance offers numerous benefits, including conducting outreach to communities to better understand current efforts in the field, learning opportunities about innovative practice models, identification of gaps in knowledge to help direct research, and an assessment of capacity of groups to advance a policy agenda tracking local, state, and national policy changes. We recognize the important contributions that have been made by those who have been engaged in the childhood obesity efforts, prevention efforts for decades. So a critical component of our efforts is to effectively facilitate, document, and respond to technical assistance requests through reviewing and compiling existing technical assistance materials and engaging with existing TA providers, and then funneling those requests who are best suited for responding. Ours also include identifying, providing training opportunities, developing tools, webinars, and so forth, and developing evaluation mechanisms to determine the impact and outcomes of your efforts. Delivering technical assistance a primary step in strengthening and expanding the field and assisting the reversal of the epidemic by 2015. Childhood obesity is, at its most basic level, caused by an imbalance of energy. Energy taken in through foods and beverages has exceeded the energy expended through daily physical activity, normal growth, and daily living. Our policies have unintentionally been driven by priorities that undermine families' ability to provide this proper balance for their kids, and has significantly contributed to the epidemic. But today, this obesity epidemic is not simply a health issue. Just as past policies have unintentionally contributed to the problem, solutions must intentionally focus on reestablishing an environment within which all families can flourish. We must intentionally examine policies, priorities, and actions to achieve the needed changes, and these include cross-agency policy and synergistic efforts in the fields of transportation, education, our built environment, parks and recreation, nutrition, food marketing, agriculture, and many others. And this partnership with InPlan is an important first step in making those legal tools available and developed appropriately. In closing, I'd invite you to visit our website at www.reversechildhoodobesity.org. It's continuously updated, site that you can use to share your work, find resources, and stay informed. Manel, Christine, we're excited to be with you and look forward to learning what participants need and being able to respond to that as we join forces together to reverse the epidemic by 2015. Thank you.
Thank you, Joe, for that introduction. Now we will turn to the main event for our webinar. We have Heather Wooten here from Public Health Law and Policy, which is also NPLAN's parent organization, and she will be talking you through the basics of land use and zoning policy to create healthy communities. Heather?
Great. Well, I'm very excited to be here. As Christine gets my slide set up, I just wanted to introduce myself really quickly. As Christine mentioned, I'm a planner here at Public Health Law and Policy. I work on the Planning for Healthy Places team, and we work to help communities understand how planning and economic development processes work and how to participate in and influence those processes to improve health broadly. We have a focus on issues related to neighborhood livability and healthy food systems, and so today's topic really fits into the core mission of our work. So things that I wanted to start off by doing is talking about what we mean by the built environment. We're here today to learn about tools that impact the built environment, but first I wanted to give a bit of a definition. So when we talk about this, we're talking about human-made settings that provide the context in which we go about our lives, and that includes our transportation infrastructure, our housing, parks, schools, etc. There's a phrase that I like to use that I think captures this very effectively, and that is we're talking about policy in concrete, that these are investments and decisions made by human beings that result in the environment around us. We're talking about defining a healthy community. We're also talking about thinking on just the health of individuals. So not just talking about individual people, do you smoke or do you exercise? We're talking about how context and the built environment shapes health behavior and outcomes. In other words, our outcomes are impacted by our environment and the context in which we live and make choices. And I think that's pretty common sense for a lot of people, and I want you to just take a look at this image and think about, when you see a place like this, what do you think some of the health consequences of living in this community might be? health consequences related to childhood obesity, for example, or even those related to air quality or social capital and mental health. What about when you see an image like this? What do you think the health consequences of living in this community might be? I had the opportunity to visit London, and it gave me a really fresh perspective on this issue of how the environment impacts behavior. So London has made a commitment to getting people out of cars, and they've been working hard to promote biking. They use revenue from their congestion fee, which is essentially a toll on cars to enter central London, to fund social media campaigns, programs, and infrastructure. Biking was everywhere in the city. I mean, I saw commuters biking, students biking. It was promoted as cool and sexy, and I think also a way that people are really saving money on transportation. And I had been there a year before, and the difference in the numbers of people who are out, getting the daily physical activity through their commute by biking was just staggering to me. I mean, these infrastructure investments and investments, I think, are really making a big difference. So that introduction, I wanted to give you a little bit of a roadmap for today's training. This is a very short introduction to planning. It's more of a commercial than an in-depth training, but what I hope to do is provide some resources and tools that you can use and follow up with. So to talk about three main things today. The first is just a quick overview of the impact that the built environment has on health, particularly thinking about childhood obesity, and what the steps are to participate in land use planning processes, and what exactly do land use tools do. And we're going to talk about some resources available to do this work in community. So the first thing that I wanted to talk about, again, is the evidence. What research says about how our community design impacts our health. That I'm showing now came from a study looking at the food retail environment in California. So looking at what kinds of stores were in people's communities. And this is state data. You can see that 14% of stores were supermarkets, 2% farmers markets, 3% food stores. 25% of stores were convenience stores, and 6% were fast food restaurants. When you add this, it becomes really clear that that choice is actually not the easy choice in most communities. That when you walk out your door and you're more likely to connected with convenience stores or fast food restaurants, and you're busy and you're going about your daily life, it's going to be the places that you're more likely to shop. And we know that predominantly those stores have fewer healthy options than other kinds of stores. We know that through research issue that the presence of convenience stores is associated with obesity. And I think, again, that this is kind of something that's instinctive to people, that you think, yeah, you're surrounded by this. If this is saturating your environment, this makes a lot of sense. But now we're having the research to actually back this up. We also know that people are less likely to walk when they live in communities that have traffic hazards and poor intersections. And I think, again, that also makes sense. We also know that the number of miles traveled by motorized transportation is associated with obesity rates. So the more time you spend in a car, for example, the more likely you are to be obese. And when we design communities where you are forced to spend a significant amount of time in your car just to go about, your daily activities, whether that's getting to work, getting to school, go somewhere, even going to a park in a car, that all adds up in terms of the cost that has on our lives. But the important thing to remember here is that policy can actually reverse these statistics. So we have, in many communities across the country, adopted land use policies that support sprawl and fast food, but these same policies can be used to improve health as well. The tool is flexible, and it can be used to create healthier communities. Again, I just want to point out at this point in time is that when we create community environments that promote health in one disease silo, so for example, obesity, we're actually impacting multiple health outcomes. So for example, if you design a community that supports and promotes walkability, you're actually getting at a lot of health issues. That can include rates of obesity, it can include air quality and respiratory health, it can include traffic crashes, and it can include social capital and mental health as well. So the good news in this work, I guess, is that making these kinds of changes really has a profound and systemic impact on communities. Of course, the challenging part is that these are long-term changes, long-term processes, and that you really need to be committed to being engaged in the work over the long haul. The question is, okay, how did we end up here? And probably more importantly, how do we create vibrant, sustainable communities where everyone has the chance to be healthy? This is a framework that we at Public Health Policy use to talk about steps to successfully changing community environments. And there are 4 main steps that we talk about. The first is laying the groundwork, which involves sharing information and building partnerships. Talk about assessing existing health conditions and collecting health data and conducting environmental audits. Land use plans and policies to include health considerations, and ensuring that the plan's goals are actually implemented. And we have a number of tools that we use to make that translation. I'll give examples and details for each of these, but I just want to note that these steps aren't perfectly iterative. They're not perfectly linear. It's a very iterative process, and people come in at different points in time. You may be doing all of these 4 steps at once. But in the communities where we work, we've seen that these are the ingredients that lead to success. So the first step that I want to talk about is laying the groundwork. This is the beginning of building partnerships in your community to impact land use policy change. So when we talk about laying the groundwork, we're talking about doing things like information sharing. The 2 examples that I have here were papers produced by health departments in California, and they summarize how the built environment affects health, and they provide county-specific data on health status and make specific policy recommendations. They're both really excellent examples, I think, of a kind of formal information sharing. But you can also just, take the opportunity to pass along an interesting article to your planning department or to someone else in your community that you're trying to do this work with. It's also about collaborative partnerships, and I think Joe talked about this in his introduction. Collaborative partnerships really need to include, health departments, staff, residents, schools, hospitals, business, as well as the local government agencies who are making and implementing the policy that you want to affect. So that includes people in staff in community development and planning. It might include plan commissioners, parks and recreation staff, traffic engineering staff, et cetera. Reaching out and building these relationships is really critical to actually moving the work forward. It can be done in a very informal way as well. Personal relationships really sustain this work over time, and the personal relationships, I think, help to make sure that even though it's a long-term process to impact the built environment, you can create some energy and some sustained work in that area and really create a lasting impact in your community. So the second step that I want to talk about is this assessment step. I'm guessing that many of you who are participating in our training today are in the process of doing some kind of assessment in your community related to health, and may also be related to the built environment. This map was produced by the Planning Office in the District of Columbia. They've undertaken a study to look at food access in their community, and they're using a really innovative way of doing that. They're measuring access to healthy food by a walk time. And you can see here they've mapped out grocery stores in the District of Columbia and those areas of the city that are within 5, 10, and 15-minute walks from a supermarket. And you also notice that they did something which is very savvy, which is map these stores out by their council wards. So they're intentionally creating some political accountability when they're showing this kind of data. And for those of you who are familiar with DC, you'll notice a pattern that's probably not surprising, which is that the 7th and 8th wards are very underserved by food retail. Those are predominantly low-income communities of color, and this map really makes that statement. So here's the data in another way, which is these bar graphs, and I just wanted to show this because this is probably a method of showing data that is more familiar to health advocates who may be used to thinking about data by demographic groups such as race or age. But, you know, planners and elected officials really do respond to data, and if you have the opportunity to present your data spatially, I think it has a bigger impact. So what I'm talking about here is not just the process of collecting the data itself, but how you share this information with decision makers so that they're able to understand, interpret, and apply that to policy. This is another innovative map that I wanted to show you measuring walkability. So studies show that most people walk between about 1.25 miles to a destination. If a destination is further than that, they drive or take some other form of transit. So here you can see a theoretical versus an actual walk shed. So I'm just using an as the crow flies measurement to determine whether this is walkable. They look at actual sidewalk network conditions. So you can see here that the dark green lines are the actual 5-minute walk, and the dark red lines are the actual 10-minute walk versus the circles, which is the theoretical. And there are a lot of things that impact actual walkability in a community. So, for example, there might be a freeway that is impossible for people to walk, or it might just be unpleasant for them to do so. I mean, walking under a freeway can be a real barrier for a lot of pedestrians. It looks at things like, does a street connect through, or do you need to cross an 8-lane road to get to a destination? So this is a kind of strategy that, again, makes this point very impactfully. It's using information about a community to show exactly where accessibility could actually be improved, because if you look at this, there might be some opportunities to connect the sidewalks through, or to put in some pedestrian-friendly amenities to actually increase the accessibility of this neighborhood. And I just want to also say that you don't worry about having fancy statistical models or sophisticated mapping software to do this work. I think the real message here is that your knowledge from daily practice is very persuasive, that there's a really big difference between politically valid data and scientifically valid data. What I mean when I say that is that it's as though you should fudge your numbers or not do rigorous analysis, but that politically valid data often focuses on a single issue. It's easy to understand. It makes a point clearly to the change that you're trying to make, and it responds to the actual community in which you're to make policy changes. So this is just a hypothetical little graph that I put together of if you went out and did a walking assessment in a neighborhood, you know, you can just have which streets are meeting your goals for pedestrian friendliness, and then overall targets, and you immediately begin to see where improvements could be made. So the third step that I want to talk about is updating land use plans and policies. And before I dive into that, I want to talk about who actually makes land use decisions in most communities. So this is an organizational chart for a generic city. Your particular city might be organized a little bit differently than this, but this is pretty standard in most places across the country. So you have here a mayor or a city council and city departments, including a planning department. Planning departments or community development departments are tasked with implementing and applying land use regulations and policies. And staff also prepare, report, and support other city functions. So it's important when you see a chart like this to think about who you need to build relationships with, and planning department staff are certainly among them. We also have commissions in many communities, including planning commissions. If your community has a plan commission, its job is to advise the mayor or city council on policy. They don't make policy themselves, but they do pass along their recommendations for projects and policies, and this is another place where you would look to build relationships and watch what decisions are being made. The final decision-making authority is going to rest with your elected officials. So your city council or your county board of supervisors will be charged with actually adopting land use policy. So this is sort of a simplified way to look at how these decisions are made, and the truth is, in some communities, to play out differently. You might have communities where everyone feels like it's really developers who are making all the decisions, or a particularly powerful environmental lobby. But the idea here is to understand what the dynamics of your own community are and figure out who you make relationships with and who can be supportive of policies that you're interested in passing. The first kind of tool that I wanted to talk about are comprehensive plans or general plans. Comprehensive plans lay out policies that determine priorities for how a community grows and develops, and that includes policies related to land use, housing, transportation, parks and open space, all of which we know have an impact on childhood obesity. So different states have different legal requirements for plans, including what topics specifically must be addressed, as well as the actual legal weight of plans themselves. But most urban communities have some kind of comprehensive plan, and I encourage, if you're living in a community where you're either going through a plan update or maybe just starting to consider a plan update, to get involved. This is a great place to start laying out the broad goals and visions for a healthy community. And they're long-term policy guides, and they cover 10 to 30-year time period. This gets back to a message that I brought up at the beginning of this call, which is that getting involved in land use planning actually impacts your community for a much longer time period than you may individually be doing this work. I want to talk about a few strategies to consider in incorporating health policy into land use plans. So one of the things we talk about is visibility. I really encourage, if you have the opportunity to participate in a plan update, to get health goals right at the center of the plan itself, right in a community vision statement. That lays out a commitment to community health and to children's health right from the very beginning, and I think sets a great stage and builds political capital for doing this work. We all talk about the functionality and usability of plans, who exactly will be using them and implementing them, including staff, including developers, including others in your community, cost effectiveness of engagement. And then I think the most important thing actually to think about is the ability to implement plan policies, and I want to talk a little bit more about that. This is probably going to be the wonkiest part of my presentation, at least I hope it will be. I love to read zoning code, which is not something that I think most people find scintillating. It would certainly put, I think, the average person to bed at night if they were reading it. But there's a lot in that language, and it can actually be very powerful. So I'll give a few examples of what I mean by that. So policy, a sample policy that says, promote opportunities for regular physical activity by locating residential developments near services. Well, that's like a good policy, right? You'd be increasing the likelihood that people would be able to walk to meet their daily needs. But our policy must set a walkability standard. For example, a quarter, half mile, this distance we know most people are likely to walk, for access to daily retail needs and nearest transit stops. You're also specifying here exactly what uses you want people to be able to access on a daily basis. And policy is very interesting because it not only sets a standard for where you want to go, but it actually lets you measure your community now to see who is currently being served by that standard. You could look at neighborhoods and map out, what percentage of residents currently meet this standard and where priorities for infrastructure investment or development might need to go. I'll go through one other quick example, which is encourage the development of community gardens to increase residents' access to healthy foods. Again, this sounds like a great policy, kind of motherhood and apple pie. But a better policy would be, and this is an example that I pulled from Seattle, Washington, establish one community garden for every 2,500 households households in urban village and urban center. And the reason why I think this policy is better is that it, first of all, sets a standard of level of service, basically, and it also defines where exactly community gardens should be located. So they're talking about this sort of place, urban village and urban center, which is a kind of Seattle term for neighborhood. This policy gives you much clearer guidance on where and how community garden development should be prioritized. Just through this one really quickly, because we're running out of time, but I'm happy to follow up with people who have questions about how to strengthen policy development. Move on to our implementation section. This is where the rubber meets the road, as they say. It's about translating a policy into on-the-ground change. There are a number of tools that we use to implement land use policies. And I've posted a number of them up here. The one that I'm going to spend most of the time talking about today, just because of time constraints, is zoning. But I want you to be aware of this toolbox. Just know that we may offer future trainings that go into more depth on some of these topics. Zoning is really a universal tool as well, so that's why I'm going to focus on it, unless you're living in Texas, which is one of the few places that does not use it. So zoning is the most fundamental regulatory tool that cities and counties, local government, in other words, use to shape land use and the built environment. It's like the DNA of a community. It controls what can be built, what standards, buildings, roads, and other community infrastructure must conform to, and what activities can take place in a given zone. Zoning functions in three core ways, and I'm going to talk about each of these and give examples. As a regulatory tool, the first of these is that zoning can place requirements on development. So, for example, zoning codes can require that new housing development provide a certain amount of park or open space. Zoning codes can also require pedestrian and bike-friendly features like traffic calming, infrastructure, and bike racks. It's one of the places that developers will look to see what needs to be included in their development, and it's also what a planning department would look to see if a development is conforming to what the community has set out as its standards. The second that zoning functions is to incentivize certain uses and kinds of developments. So, for example, New York City recently unveiled a new initiative called Food Retail Expansion to Support Health, FRESH, which combines zoning changes and some financial incentives to make it less costly to developers to include supermarkets or projects. So the proposed zoning changes here allow developers in specific target communities in New York that have been determined to be underserved by healthy retail to build larger buildings than they would otherwise be permitted under the existing zoning if they include a neighborhood grocery store on the ground floor. So this is a way to sort of get development to work in your favor and incentivize the kinds of healthy infrastructure that you want to see in your community. The last way that zoning really functions is to restrict uses and development. So, for example, zoning has been used to restrict fast food chain formal restaurants in communities across the U.S. In the past, it's mostly been used to this for non-health reasons, such as aesthetic concerns or wanting to support local business and local entrepreneurs, and also a little bit from traffic and safety concerns, which also has some health overlap. But with things that, or one of the examples that I think is breaking the mold on this is South Los Angeles recently made news for passing a temporary moratorium on fast food, but they did that moratorium and wrote in the actual language itself. They're doing it explicitly for health and quality of life reasons in the community. And I think that protecting and promoting public health is at the core of why zoning is considered a valid government activity, and this is certainly a valid exercise. Just really briefly, to help us understand what zoning actually is, it's two components. There are codes and maps. So codes, like the example here, tell you what uses can take place in a given zone. So look at this chart, you might notice that it's pretty complicated. Each use listed may be permitted as of right, or it may require a special permit. codes are often really dense, and especially if they have not had a comprehensive cleanup or update in a number of years, which is true of most communities, they also can be confusing and contradictory. So I would encourage you to use your planner friends to help you interpret and understand local codes. The second part of zoning is a map component. So text and charts correspond to locations in a community and show where specifically different regulations apply. Traditional zoning separates uses into different physical areas. For example, residential, commercial, and industrial uses would all correspond to different colors and would be separated from one another. And this made a lot of sense when zoning was first developed, and we worried about keeping industrial pollution from homes. But we've now ended up with a situation where you need a car to get everywhere, and people are really thinking about trying to create codes that actually reflect the diversity of uses that people would want to have within a neighborhood or in a community. I'll give a few examples of the kinds of innovative tools people are using to do this. Traditional zoning doesn't always lead to the kind of development we want to see, and these new tools like design guidelines and form-based codes are being used to create a more responsive zoning ordinance that actually describes the design features of development. And this is really important for advocates of walkability and bikeability, since studies do show that the design of a street or neighborhood, like the presence of street trees or pedestrian-friendly lighting or sidewalks, does in fact affect how likely we are to want to walk there. This is just another kind of visual example of design for traffic calming. These kinds of tools are being adopted to help create the kind of development that actually supports health and safety in communities. And what we're talking about with all of these tools today, with plans, with zoning code, and with other tools in these planning toolboxes, is changing the use of these policies from, a place like this where you can see the policies here have created an auto orientation landscape, to making changes that move from thinking about and streets as being arterials that move individuals, to actually creating that supports mobility, especially mobility for people who have automobiles, really feels more like a place. Simulation shows adding features like buildings that face the street instead of acres of parking, adding street trees, increasing density, and actually support the kinds of healthy behaviors that we want people to engage in, and get them, make it more likely that they can choose a healthy lifestyle. I'm going to go through a few resources now as I wrap up my presentation. We have a number of resources already available on our website that focus on the tools we've talked about today. And we also have a number of products coming soon that will talk about restricting fast food, mobile vending, and complete streets and safe routes to school. So check out our website now and come back, sign up for our newsletters. On healthyplanning.org, we have our toolkits, fact sheets, and funding sources, as well as model policies. We have two sets of model policies on farmers markets and community gardens that are both comprehensive plan language and zoning regulation language, talking points for communicating with decision makers. We also have model resolutions. Sorry, skipped ahead on that one. And then I just wanted to talk really quickly about the relationship between NPLAN and public health law and policy. We really work together to try and do policy and legal research and to draft model policies and model legal language that can give advocates who are out in the field the tools that they really need to be able to create these changes. Here's my contact info, and I just wanted to thank everyone and hopefully take a few questions.
So please definitely use the Q&A box to submit any questions you might have. Just checking if there are any that have come in. We have a question that came from Mark a little earlier. He wants to know if you have examples of policies that have been implemented as a result of cross-agency collaboration, either at the state or local level.
Yeah, that's a great question. And one thing that I've actually seen is that very few of the kinds of policies that I'm talking about actually get passed without interagency collaboration. So I'll give you an example that refers back to one of the things that I mentioned before. In South Los Angeles, this fast food moratorium that was put in place, actually, that is one piece of a whole set of policies that South Los Angeles has been working on to create a healthier food environment in their community. And there were also a series of incentives that they adopted at the same time to promote the attraction and improvement of grocery stores and sit-down restaurants, which were two needs that the community had identified. And for policy to actually be developed and take place, it actually involves a lot of interagency collaboration among the redevelopment agency, among the planning department, others in the community. One of the things that I think is important to develop, though, is that there be a single point of contact for them when they're trying to actually find out if their development would conform to or qualify for incentives and regulations in a community. And in the South Los Angeles case, they've actually asked their redevelopment agency to be the lead in attracting grocers and helping them walk through what can frankly be a cumbersome process of qualifying for city incentives.
Great. We have a question about the difference between master plans and comprehensive plans.
That question, and these terms are thrown around a lot, and you might hear things talked about as a plan in your community, including specific plans, area plans, master plans, and general plans, and comprehensive plans. This is, between these plans, from a legal standpoint, do actually vary, and they're going to vary by state law, and they're going to vary by specific technical kind of plan that you're referring to. I think from an advocate standpoint, both of them be thought about as kind of the same thing. A master plan is going to be a plan that is going to set out development standards and policies for a large area of a community over a long period of time. And that's going to be true with general plans and comprehensive plans as well.
Keeping those questions along, we're going to go back to our presentations for about 20 more minutes, and then we'll have more time for questions. So next, I would like to introduce Veva Islas-Hooker from the Central California Regional Obesity Prevention Program, and she is going to share with you her experience engaging the community in the planning process. So take it away.
And Christine, will you put up the slides for me? Sure.
Oh, sure.
Great. Thank you all. I appreciate being able to share with you a little bit about our project. The Central California Regional Obesity Prevention Program is an 8-county initiative. We work in Central California in the counties of Fresno, Madera, Merced, Kern, Kings, San Joaquin, Stanislaus, and Tulare. And we're a partnership between public health departments and community-based organizations. So our approach to obesity prevention is really from the policy and environmental change level. And of course, we believe that the opportunity to create change in our environments on a scale really lies in ensuring that community members have access to healthy foods and safe places for physical activity. Those are sort of our two buckets in terms of the interventions that we've been working on. Central California is a beautiful region with really lush farmland and very hardworking people. We suffer from some of the worst health consequences in the state in terms of outcomes for diabetes and heart disease and hypertension. So that obviously results from the challenges we experience in healthy behaviors like physical activity. So reduced activity in our region stems from the challenges of not really having access to safe places for physical activity. and community design, not really being designed to encourage physical activity. This is in one of our neighborhoods that we've been working in, the Greenfield area of Bayfield. And this is a before picture, and you can see that there's a lot of graffiti. Residents around this park really were intimidated to go to it. But I'll show you in a minute some of the that we've made there. This is an example just of the challenges I wanted to highlight. This is an example. This is a small community in Tulare County, no sidewalks, no street lights, and can't remember when this picture was taken, but this is a pretty typical day for a child trying to walk to school. He's having to walk traffic to get there, not really a safe route. Despite the irony that we live in the fruit and vegetable basket of our state, we do experience some challenges with healthy food access. Heather discussed with you, the health retail study for us indicated that we had 4 to 5 times greater access to convenience stores and food restaurants than to full-service supermarkets. So you're suffering from a broken food system. And the typical small store in our rural community, you can see just by design, people don't have the option of making a healthy selection here. Some of the actions that we've been working on, we've been trying to improve activity by creating safe places to play, by working towards complete streets. We've created a lot of working relationships with local planners in each one of these 8 counties. We've been working on farmers markets, school farm stands, a number of things. So in this slide highlights just a few of the successes that we've had. We have created changes in zoning ordinances in the city of Fresno, for example. There was an ordinance that didn't allow the establishment of farmers markets, and in the last year, our partners from Fresno County were very active at getting that changed, and there is, in fact, an ordinance now that would allow farmers markets to be established. This led to sort of a proliferation of farm stands and farmers markets on school campuses here in Fresno. It's just been beautiful to see. In working with our farmers markets, we've made sure that farmers markets accept EBT and WIC, and this was specifically because of the immense poverty that we have in our region and the number of participants that are on those programs. So we wanted to create those avenues for them to utilize the programs they were on at things like farmers markets. The funds that I mentioned to you are also in Tulare County as well as Fresno. We've done work around the concepts of joint use in utilizing school space for a safe place to play, especially in small rural communities where parks don't exist. We have been working at inserting health elements into city and county general plans. We've had some success at that. That's been real helpful. I think just to reflect a little bit on the sort of outline that Heather put out in terms of laying groundwork, assessing health conditions, health plans, and ensuring implementation, I think these give you a gamut of those examples. But one of the things that's not on here that we have done is that we did do a CX3 project in each one of the 11 target communities that we work in, and was really important in terms of engaging community members and helping them really understand the impact of environment. Because exception, most of our community residents, when we talked about obesity prevention, were reflecting on individual change approaches. And so it was a very effective way to get them to see firsthand at, the disease that they have to live in as well. All of our work has been community-driven, and that's been very important because we've had accommodations to ensure that community members can, in fact, be involved in the planning process. So we provide interpretation, we've done translation. Most recently, we've been working with Public Health Law and Policy at actually doing Spanish language Land Use 101 trainings. So we're helping to increase the community members' knowledge and capacity to develop involved in the planning process. Ways that we've helped lift up the community voice to be involved is through doing a photo voice project. This young girl who did a project in the city of Delano. This information from the photo voice projects was shared with the local planner, and he has incorporated that as a community feedback mechanism for his general plan. At the conclusion of all of these photo voice projects, we did do a community presentation, and we brought stakeholders to community presentation and allowed the youth to directly talk with their elected officials, with other residents in the community about the challenges to healthy eating and active living from their perspective. And it's a very powerful tool to engage youth in advocacy themselves. Some of the photo voice pictures we actually developed into photo voice postcards, and we sent it through the region to decision makers to help educate and inform them about the need to support healthy eating and active living. Another way that we've used the voice projects is by working with a partner, Map for Change, and they've actually GIS plotted these photo voice projects on a map. So when you scroll over them, the community, you can see the results of the photo voice findings. They're also available on our website if you'd like to look at them. So in the Central Valley, was this region-wide Valley Blueprint planning process, and we have to bring in non-English speakers to those meetings, and this is an example of them being involved in a charrette. This is the Grilled Walking Group, and that earlier slide that I showed you with all the graffiti, well, you find that anymore because the graffiti's gone, but we ladies have just been phenomenal. They developed relationships with their local park and rec department, got lights in their parks fixed. They've developed relationships with local law enforcement. Graffiti's been removed. Police are much more diligent about the activities happening in the park, and so it hasn't been a welcoming environment anymore for gang activity. Animal control came out, took all the loose dogs out of the park. And these women even went as far as raising funds to establish a perimeter around the park that was an easier opportunity for them to walk with their strollers. Now they engage in daily physical activity. They've organized aerobics as well as walking in the park. Ceres is one of the communities that we work in, and by working with their park and rec department, they established a farmers market at a local park, and that farmers market does accept senior vouchers, EBT, and WIC. This is the farm stand in Pixley, California, and these are youth that man it. The youth are involved in bag produce, manning the stand. The proceeds from that farm stand go directly back to the school, so it's a fundraising opportunity for them as well. And it's just a really awesome sight to see parents picking up their children on Wednesdays when the fruit and vegetable stand is operating, and then taking them over to buy some produce before they go home. Similarly, here's a farm stand in Fresno, and you can see that the youth are active consumers there as well. Again, I want to thank you for the opportunity. I want to say that our project is funded by Robert Wood Johnson as well as the California Endowment. And engagement with community has really rested in themselves being active at moving forward these policy and environmental change efforts. And we're investing in their leadership development, and I encourage you all to do the same. Thank you.
For that wonderful presentation and the beautiful pictures. Next, we're going to before I turn to Nina, I just want to say I've gotten a lot of questions about whether this information will be available after the webinar, and it will. We'll post PDFs of the slides and a recording of the webinar for those who may have missed the presentations. So next I'm going to turn to Nina Walford of the Transit Authority of River City, which is Louisville, Kentucky, and we will be talking about the city's walkability plan and implementing policies from that plan. So you're unmuted, and I'm going to pull up your slides.
Well, thank you. Advance it, or do I do that?
You can go ahead. You have control.
Not advancing.
Well, good then.
Okay. Just give my introduction. Okay, well, this was a presentation that was presented in a longer format to the American Planning Association and also to the American Public Transit Association. There's a lot of interest right now in walkability and improving the built environment. This work grew out of our Active Living group, which was funded by the Robert Wood Johnson through its Active Living by Design group, and the purpose of Active Louisville was to encourage physical activity as part of daily living and to remove obstacles in the built environment that make physical activity, impede physical activity. So one of our major impetuses was to improve, sidewalk and streetscape to make walking easier and more pleasant. So we did that. Let me up and give my background. I'm with the Transit Authority of River City. We've been an active partner in all of this work because we believe that transit and walkability are equal footing in terms of the need to keep people out on the street and active. We can't. Every bus rider is a pedestrian at some point, so we're very invested in the pedestrian infrastructure. I'm also chairman of the Active Living Committee of the Mayor's Healthy Hometown Movement, and again, it's an outgrowth of our Active Louisville work we did under the Robert Wood Johnson Foundation. I don't want you to think Louisville looks like this everywhere. It's actually a very beautiful, walkable city, but we do have issues in certain areas, disconnected and dead-end streets. I think Heather went over this ground pretty well about how these are not how healthy communities work. They certainly don't encourage or facilitate walking or any kind of physical activity, really. And same with schools in our community. I don't know why that laughed. In a community, you are guaranteed a bus ride. Are these jumping around?
I'm controlling them, Nina.
Oh, you are? Okay. If you would go on to the biking to school slide. The schools here guarantee a bus ride for anyone who lives more than a mile from the school, but that's been whittled down to really a half mile, and really the policy is that bus rides are the default, and you have to have sort of special dispensation to walk, and that's certainly a policy we would like to kind of start reversing the thinking on, that walking would be natural for anyone under a mile, and a bus ride would be the exception. So we did a pedestrian summit that produced this walkability plan last year. The summit was in May. The plan came out in June. There's our website. The full plan is available there. It was organized around the 5 Ps that Robert Wood Johnson advocates. That is preparation, planning, programs, policy, and physical improvement. I'm pulling out the parts that are related to policy here. So the next slide will show just some issues regarding getting stakeholders involved in this work, energizing communities, teach developers why walkability is important so that they buy into the concept of putting sidewalks, make subdivisions interconnected, not doing stub streets, not doing cul-de-sacs, those kinds of things that really sort of create these auto-dependent communities. And we also created a walkability leadership task force under the Pedestrian Summit, and we're continuing to work with that. So all of this was begun when we did the Pedestrian Summit last year. The next slide. So some of the other things, and we had 2 excellent planners involved in this plan that could talk about these things, but just roughly, land development code is the nitty-gritty of the comprehensive plan. That's where the actual regulations are codified, and so we have been researching that to look at ways that we can eliminate policies or practices
or codes that are do not enhance walkable communities. These are more or less falling in our mid to long range goals. We actually haven't begun work on this. I'm going to talk to you a little bit about where we spent the last year, which was the low-hanging fruit and some quick successes, and so we could raise the profile of all of this. But these kinds of things are what's on our mid and long range plan. Say the next slide, we do have a complete streets policy here, which is really fabulous. Took a lot to get it adopted, but it's still in the shall phase. You shall do this. It applies only to new road construction, not rehab or old maintenance. So we're trying to move toward getting that a little more oomph in terms of a regulatory force. We involved pedestrians earlier in the transportation planning process. We've done, as part of the walkability assessments in neighborhoods, where we get a group of people to go out and assess their neighborhoods. I know a lot of communities out there are doing this. Then we're getting those recommendations adapted into their small area plans, which are the neighborhood plans, that then become the foundation for the comprehensive plan. So if we have those kinds of recommendations and priorities for pedestrian environment included in the neighborhood small area plans, we're hoping that the transportation planning process will bring those in and know that, refer to that so that they can reflect the community desires and needs. School site design, that's a whole other big topic, but needless to say, we're trying to make that a little more consistent with healthy planning as well as safety. You know, right now they're basically all about the safety, so they become very car-oriented and bus-oriented and very difficult to make walkable. And again, we're just looking at roadway definitions that are more friendly to pedestrians. Next slide, we have summit results. 1 year later, we have created a separate advocacy group called Step Up Louisville. That's some higher level people who are working on creating awareness of walking and organizing groups and getting information out. We've expanded our Mayor's Miles program, which was sort of lying fallow when we had our summit, and if you see those icons on the bottom, those are the ground stickers that we're putting in parks and neighborhoods where they ask for them. You put those every 10th of a mile, and there's signage that says you are now doing a Mayor's Mile. That's been so popular, there's been so much interest in that we're actually rejigging it a little bit to make some more standard guidelines, because different neighborhoods want to do different things. So that's a good thing, and we hope to continue to roll out these Mayor's Miles all over town. We've also improved the linkage. We have a big active bike community here. The bike and the walking, there was a little bit of a disconnect. So I'm chair of the Active Living Committee, and currently we're trying to interface those bike and walking initiatives to coordinate whenever we can to make sure we're on the same track and not going off in different directions. So I think that's a really positive step for all of the built environment initiatives that bike cyclists and walkers support. Results on the next slide. We have a Healthy Kids, Healthy Communities grants. Again, thank you, Robert Wood Johnson Foundation. That's allowing us to do these walkability assessments in 12 target neighborhoods, among many other things related to healthy foods, and linking to a loop, a 100-mile loop that is being built around the city. We want to make sure that the low-income neighborhoods are linked into that loop as well. We've developed a joint, and again, this is an example of us trying to improve the coordination between walking and bicycling initiatives. We're doing a joint Street Sense campaign, and we have breathed some new life into the Safe Routes to School grant program. We are coordinating it with the schools and making sure that they follow through on applications. We're also tying in the Safe Routes to School with the Jefferson County's Healthy Living new magnet schools that they've created. The next slide shows some of the current projects. This Street Sense campaign, there's the logo we've just designed. This is going to get rolled out here in the next month or so in the forms of bus wraps and street signage. And then this is just to create general awareness, and then we'll be drilling down to specific messages for bicyclists, drivers, and walkers in terms of safety. We're just finishing up a bike master plan that's going to look at all the roadways, their capabilities and ability to induce biking and walking so that we know where to focus our energies. The economic stimulus has thrown a really, a great into this in terms of giving some money for sidewalks. We're trying to monitor that, ensure that as many sidewalks as possible come out of that. Other programs like this Brownsboro Road Diet is where the road narrows to increase walkability. It's a neighborhood that has a very high volume, fast-moving traffic right through it. So and there's a blind school there. So the objective is to narrow the road, put a sidewalk in on one side so that there's better pedestrian access there. So finally, I have a picture. This is the plan. This is about 50-page document that has very much detail about planning objectives, planning needs, specific development codes we want to pursue, and you can download that at Step Up Louisville if you want to read the full document. I appreciate being able to present, and hope you'll come to Louisville and do some walking.
All right. Thank you, Nina, for that presentation. Love to come to Louisville and do some walking. I'm going to move us along to the a presentation, our final presentation before we open it up for as many questions as we can take. I want to talk a little bit about Ann Monell, the director, provided a brief introduction to our work, but I want to talk a little bit more concretely about some specific resources that you can find on our website now or in the very near future. So NPLAN developed model policies and other legal tools for communities to use to improve access to healthy foods and physical activity and to improve landscapes that might look like this. So to make these types of scenes more friendly to pedestrians and maybe have a little bit more healthy food that folks can purchase. As we've learned, the type of environment has a huge impact on the community's health. So we're working to improve that. It develops model policies. This is what we mean by model policies is actual language that you can download off of our website. It has fill in the blanks. It has notes that explain why certain provisions are in the policy, and you can customize it to the local needs, working with an attorney in your area. We, to support our model policies, do a great deal of legal research, both in-house, and we commission research from some of the top scholars in this country. And it serves as foundation for our policies and also can be really helpful for if you're working with a city attorney or county attorney in drafting a model ordinances, model planning language that achieves your healthy community goals. So now I'm going to walk you through some example policies that maybe your community is working on right now or that you might be interested in working on in the future. So the first products that we released was a set of tools related to joint use agreements. And joint use is a concept that means that opening up school facilities for community use after school hours. So if you've ever gone running on your local high school track, in the afternoon or late evening, you've probably taken advantage of a joint use agreement. So it's a great way to maximize limited community resources, and it's really a matter of putting a good, sound, comprehensive agreement in place between your community, your city, your Parks and Rec department, and your local school district. So we have 4 sample agreements that you can download off of our website. We also have done a great deal of liability research because liability is often a concern of schools in opening up their property. And we have a fact sheet that advocates can use to get up to speed on the issue and educate the community. We are currently finishing up a lot of work
on complete streets. This is a concept that's come up from a few of our presenters, and complete streets are, just to remind you, streets that kind of look like this one that you see on the slide, where the bicyclist who's happy and safe there. We've got pedestrians who are able to use the sidewalks and the crosswalks without fear, and those cars are moving smoothly, and you have public transit, all moving in harmony. So complete streets are a tool that can help create a scene like this. And so although these aren't available on our website yet, you know, we will be releasing these shortly. Heather mentioned zoning for language for farmers markets and community gardens. Both of these are great ways to bring healthy food into a community. Farmers markets, of course, are more temporary facilities where you can have folks selling produce, fresh fruits and vegetables, and then community gardens, of course, can be more permanent facilities that the community can use to grow their own food. It's a great way to get kids involved in learning about where food comes from. It doesn't come from a grocery store. We are working on healthy school food zones. This is hot off. It's so new that it's not even hot off the presses. Hasn't even made it to the presses. But I want to present it just to get you thinking about it. This is a model zoning ordinance that prohibits new fast food restaurants from siting within a certain distance of schools. So this is really promoting the idea that you know, kids should have access to the unhealthy food, especially during the school day. So if kids are able to walk off campus to get food at lunch or something like that, this keeps the fast food at bay. So we're working on that, and we'll be ready to provide technical assistance on this type of ordinance very, very shortly. Finally, another policy that's in development is a toolkit on promoting healthy mobile vending. A lot of communities have mobile food vendors. In rural areas, you might see trucks on the side of the road selling fresh produce. In my neighborhood in San Francisco, I see people every day with push carts selling everything from ice cream to tacos to fruit. So this is another excellent way to bring healthy food into communities that may not have bricks and mortar food stores. And New York City, as you may have heard, is working on a project to provide incentives to mobile vendors to provide healthy foods in certain underserved communities. So we're working on a model policy to incentives for mobile vending and other resources that will help you implement such a policy. So that's what we're working on that's related to the topic of today's webinar, but we want to be responsive to what you're working on the ground. So we would love to hear from you about policies that you're working on or that you would like to work on and that you'd like us to consider developing legal resources on. So feel free to throw out your ideas in the chat or in the Q&A or you know, posting them on our website after the call. So now I'm going to pass the mic on to Manel, and she's going to wrap up.
Hi, everybody. I'm just going to spend a couple of minutes giving folks a little bit more information about N-Plan structure and how to access our services. And I'll be brief because I want to make sure we have time to take questions. As our name suggests, we are a national network. Here at Public Health Law and Policy, we have a great interdisciplinary team that's made up of lawyers, folks with public health expertise, public policy expertise, urban planning expertise, people like Heather, and health educators. The N-Plan team specifically is made up of 6 lawyers and Christine, who is our public policy expert. I know what you're all thinking. You're thinking, lucky Christine, get to work with 6 lawyers. And then we have a national network of experts who advise us on our policies. Nina, who presented earlier, is one of those experts, and there are many others like her who help us make sure that our policies are accurate and responsive. I'm going to now just talk a little bit about how you access our services. So all the materials that Christine talked about today are available on our website, which is www.nplanonline.org, and you can download the materials. You can also send us emails through the website. So if you have additional questions that come to you after today's presentation, please don't hesitate to send us an email through the website. We do trainings like this one and trainings at conferences. Publicize those trainings on our website, so that's a good way to stay in touch and see what we're up to. And we also provide, in certain circumstances, in-depth one-on-one technical assistance. Specifically, we work very closely with the Robert Wood Johnson Foundation grantees. Those are our primary target audience for the one-on-one technical assistance. But we also work with communities that are actively pushing policies forward. We call them sort of the early adopter communities. I'm sure many of you are in those communities, communities that are working specifically on policies that we are also working on. And the final slide here is just a picture of our website. Again, I'll say the link. It's www.nplanonline.org. And I just encourage you all to visit the website, take a look at the resources there, and get in touch with us. Through the website. With that, I'm going to stop talking, and we will take questions from all of you about the Healthy Planning 101.
So now I have about 8 or so minutes to take questions. We've received several through the Q&A, so I'm going to go through some of those, but feel free to submit them, and I'll choose the ones that we're going to have answered. So the first question that I want to throw out is, I'm going to toss this to Veva first, is about what kinds of planning and healthy community policies are specifically successful in rural communities.
Sorry, Christine, can you repeat the question?
Sure. Where the question is about policies and planning tools that have been successful in specifically rural communities.
Policy planning tools that have been successful. Well, the elements that some of our partners have worked at incorporating into county general plans have been health elements that speak to the development or the development of sidewalks and street lights. Our community residents feel really challenged in being able to walk around their neighborhood in evenings when it's cooler. Some of you may know that the Central Valley is usually triple-digit heat in the summer. So that would be an example. Of our clear that more access to fast food restaurants and convenience stores than actually service supermarkets. Another idea that's been discussed.
yes, no. Please via the chat if you can hear me. Okay, great. Thank you for your patience. We are, I'm sure what happened there, but we will continue.
We're trying to avoid your questions.
We are not trying to avoid your questions. So, Heather and Veva were answering a question about the rural policies that work in rural communities.
Yeah, I was just saying that the same tools that we use in urban communities can be used in rural communities, with just aligned to the context in which you're using them. So I talked in my presentation about walkability standards. If you set a walkability standard that is a quarter mile in a rural community, residents should have access to a grocery store within a quarter mile, that might not be an appropriate standard. I think what you need to think about are what would the appropriate standards be? Would it make sense to put in infrastructure that does support healthy behavior like walking? You might not have sidewalks on every street. That might be an expectation in an urban community, but it might not be appropriate in a rural community. You might want to prioritize, places where kids are walking to school and things like that. So I would just say that the challenges of rural communities are real, but that I think that there are some good models out there for how you deal with them.
Great, thank you.
If I could just add one more thing in that. Some of our rural communities are unincorporated communities, so we had to deliberately create linkages to County Board of Supervisors and the county planning departments in order to affect change.
Great. We received a question from a listener about the Street Sense program, and I believe that was for Nina in Louisville. Oh, but it looks like she is suffering from the same technical difficulties that we've been having. So I will move on to another question. So we received a question about how to ensure that EBT access is sustainable at farmers markets.
That's a great question. One of the things to think about is where a farmer's market is located in a community. So you have a farmer's market located in a community that is either predominantly low income and likely to be using some kind of federal food assistance, or is bordering with a neighborhood that is predominantly low income. You really want to think about having EBT acceptance. And one of the things that can be challenging about accepting EBT at farmers markets is the actual administration of the program itself. You need to have a process by which EBT cards, which are like credit cards, can be swiped, and the amount that they're spending can be debited. And one of the strategies that I've seen communities use to kind of lower the overhead cost to the market itself for having to do that is to have a nonprofit or other organization manage that process, and they'll have a wireless machine that you can swipe and exchange for what's called script, which is a token that customers can then take and spend at a market stand, and the farmers themselves then redeem the tokens back for the value of those tokens at the end of the market. I saw an interesting report that was put out by the USDA's marketing service. They closely watch and assess sales at farmers markets in the country, and I believe it said something like $24,000 was spent in food stamp funds at farmers markets nationwide last year. That's an approximate figure. That's what I'm remembering at this point in time, which doesn't sound like a lot of money. And I think that the reason why it's not a lot of money is that few markets are actually accepting EBT, and we should be working with markets to actually improve the accessibility of these places through the kinds of programs that I mentioned.
Great. Well, we've come to the end of our time right now, and I apologize for the brief interruption in audio. Hopefully you can all hear us again now. I just wanted to let you all know that we have another webinar coming up in September. We haven't scheduled the specific date yet, but that will be coming soon. And it will be focused on community gardens, from research, legal, and public health perspectives. perspectives. So we hope that you all will be able to join us for that. And if you have any additional questions, or if you want to download the recording from today's call or slides to show to your colleagues, all of that can be done at nplanonline.org, where we'll also post links to the websites of all of the presenters. So thank you once again on behalf of NPLAN and the Robert Wood Johnson Foundation Center to Prevent Childhood